mynews.studio.
We're starting today with a headline that stands out. Imagine $2.5 billion moving directly into women's health, focusing on diseases that have been set aside for decades. The big question is, could this finally close the gender gap in medicine?
And just to mark the day, it's August 30th, 2025. Let's lay some groundwork. For decades, women's health research has been chronically underfunded. Historically, less than 2% of medical research funding has gone to pregnancy and reproductive issues. That's led to delayed diagnoses, fewer treatments. Why has it taken this long to shift?
There are a few reasons: historical bias, gaps in funding structures, and also cultural stigma. Diseases like endometriosis and menopause have been neglected for years. The Gates Foundation's $2.5 billion pledge is meant to tackle that. The funding's being spread across 5 key areas: obstetric care, maternal health and nutrition, gynecological and menstrual health, contraception, and STI management.
That's a big deal. And they're focusing especially on low and middle income countries, right? Since those are the places with the highest maternal mortality rates and the least access to care.
Yes, exactly. The initiative is homing in on regions with the greatest need, places facing the most disease and the widest research gaps. But it's not just about geography. They're also picking out specific conditions. Take endometriosis and menopause. Both have been understudied. There's new funding for research on the vaginal microbiome and for non-hormonal contraceptives, which haven't seen much attention before.
So what's held back investment in these areas? Has it mainly been a lack of funding, or?
It's both, really. Cultural stigma has played a big role, and that's affected how funding gets allocated. For a long time, research priorities were set by men, so women's health wasn't always at the center. This new initiative is trying to shift that by supporting women-led research and calling for a broader cultural change in how we look at these issues.
How will we know if this $2.5 billion is working? Are there clear goals or milestones for 2030?
They're setting out concrete milestones. They'll look for improved health outcomes, lower maternal mortality, better access to gynecological services, new diagnostics and treatments. The aim is to see a real reduction in gender disparities and to push governments and other donors to invest more. The ripple effect is just as important as the direct results.
So, if everything goes according to plan, we might see not only more research, but a real shift in how women's health is valued worldwide.
That's what they're hoping for. By putting women's health at the center and investing at this scale, the Gates Foundation wants to set a new benchmark. If other philanthropies and governments join in, we could see a major change in health outcomes and economic growth around the world.
Before we wrap up, why does this matter for everyone, not just women?
Women's health shapes families, economies, communities. When women are healthy, societies do better. Overlooking these issues has consequences for everyone. So this initiative could drive real progress, reduce disparities, and improve lives across the board.
So today, we've looked at a $2.5 billion commitment that might reshape the future of women's health. The challenges are real, but the potential impact is substantial.
Thanks for joining us. This episode was brought to you by mynews.studio. You can try it now, free.